It is buyout rescue morning. You might notice my hand is broken. They casted it all up. This is, I think I need little googly eyes to have like a little donkey head or something. That kind of look like a horse, donkey head, ears, I don't know. Anyways, I broke it and I'm not gonna be able to do as much hand stuff on today. Because of that, it is feeling a little better than it was, but I don't recommend breaking any bones. We're up here waiting for the horses to come in. There is going to be something that's happening behind the scenes here. You're going to want to watch the episode because that's where you'll be able to see what's happening. But the Almost Live is going to be focused on the horses today, like it always is. But there will be some things happening outside that you'll definitely want to watch in the next episode that we release. We are very excited about the Florida facility, getting everything ready there. I came in this morning and basically was met with the news that we might not be able to rescue these horses today because of what you'll want to watch in the episode. And it looks like it's all happening. Fingers crossed we can get these horses off the trailer and safe before what's going to happen is going to happen, and I don't know what's going to totally happen. So, but yeah, we're ready for the horses, super excited. And once everything settles down, then we'll start the intake process. So just bear with us and please watch the episode when it comes out so you can see what's happening. It's crazy.
Whoa. Hi, guys. This bay in the back left is standing on the horse that's down. Hi, easy, easy, okay. Sydney, where's Sydney? I need 10 cc's of Banamine. It is set right out. There's a syringe right next to it. Okay. Yeah, if we can get just this bay, but it looks like maybe we've got a fractured left front. This horse is just severely dehydrated. That is not the jugular, that's the esophagus. If there's a way that we can safely pull this horse just a little bit this way so that we're less likely to have others step on it, that would be wonderful. This is a gelding, and he looks to be quite old. Thank you.
Trey, I think the chestnut.
I know we're supposed to wait, but I really need to get to this horse right here. Okay.
Yeah, take
so
the chestnut.
Chestnut appears to be maybe blind on the right. Ready?
Okay, you're okay.
Easy. Okay. You're all right. I'm so sorry. Okay. Easy. She has a 6 out of 6 heart murmur. Oh, Mama, I'm sorry. Hey, Tawny. I think we're gonna have to ask her to pass here. Her heart is just given out. So this mare was down and was being stood upon by other horses. We immediately gave her intravenous pain medication and some sedation to be able to assess her better. But at her age and in her condition, and I'm not actually sure how many injuries she sustained, but she has a lot of protrusions on her chest wall right over her heart where she was being stood on by other horses. So just really tragic and so unfair for this old lady. She deserved better. Normally I try to ask them if they want to get up, but in her case, I don't think she physically could stand and she made no effort to pick her head up, but she did eat some cookies from me. Face or something, I don't know. All right, sorry, whoever's sweatshirt this is.
I think they're going to pull her out that gate right there.
Right here? Okay. Hi. You're okay. Tawny, this looks like has the severe sway back, and there's a brand on this horse. We're gonna need more hay than this. Got a draining lymph node abscess on this one. Hi friends, it's okay. Hi. That one. We got some bobs. We got some new bobs.
New bobs.
I would call these mini mules, but I mean, if they're like 6 months old, then they could just be
Babies.
regular. But yeah, I think these are all mini mules.
Okay.
I don't have an age on him yet.
Breed do you think?
He looks gated to me. He's very tall and thin. There's a chestnut down here that looks like he's got a really painful eye. The biggest chestnut down there. But I mean, at that horse with the big wrap on its leg, but I'll take whomever you want to give me. Oh, honey. Yeah. I know it hurts. Ooh, you guys see that? It's called a desmetocele, or a melting ulcer. See all the edema around that little circle? Get you some pain meds. A very good gentleman. He's got an ulcer on his lips. He's not as old as he looks. He's like 19 maybe. Ooh, sorry guys. Let's microchip him. Let's record the diagnostics that we want. And since he's stable, let's put him, he's a stud, he's gonna have to go by himself anyway. Let's put him somewhere and we'll put him down for those. Tomorrow would be great. This guy is a stallion. He's about 19 years old. I suspect he might be a unilateral cryptorchid, which means one testicle might still be in the abdomen. I didn't actually palpate his scrotum. He's been very well behaved, but he is a stallion. So my biggest concern with him, twofold. One, his body condition is really terrible and his face is a bit swollen, but he also has a very painful melting ulcer in his right eye. So normal uncomplicated corneal ulcers in horses resolve on their own in about 5 days. This is not a normal one. It needs pretty aggressive debridement of the cornea. And then we can do a procedure called an SPL placement, which stands for subpalpebral lavage, where we put a little tiny catheter with a tube up through their eyelids so we can put eye medications in the eye without having to hold open the eye. We actually have an SPL kit here at Horse Plus, but for today, I just gave him some good pain medication. He seems to be stable. I want to make sure his pain is controlled, but I have 23 other horses that we have to look at. So I'm actually gonna kind of try to triage what we need today and then write down some diagnostics that I can delegate to our wonderful technician, Nicole, who's not here today. So we're gonna make sure this guy is comfortable. We're gonna put him on pain medication every day, and we're gonna schedule him for those x-rays at another time to make sure that we can address, I think we have some other pretty severe conditions going on. We'll take radiographs. Okay. So this guy is at least stable and has had pain meds, so he's not that old. Late teens. Oh, he's older than that.
This goes all the way down.
More like 22, 23. You missing one tooth? Let's retake that. We had some movement, but overall, I think I can work with his mouth. You're okay. I know it feels weird. He looks like somebody's taking care of his teeth. Okay, let's try for the DP and see if he'll let us. 10 feet for scatter radiation. Why you got so much scleral injection on that side? See how red his eye is? think we can fix those teeth, sir. Let's do his back next. Yep. Whoop. Don't look great. See how this vertebrae is really crumbling? So there actually are surgical corrections for that where they can bridge this, but I would probably need a radiologist to look at the x-ray and then have a surgeon take a look at it and see what his options are. What's awesome is this horse isn't painful on palpation right there, but that vertebrae is very compromised. He does have a pretty severely affected vertebrae. However, he's not painful on palpation right there. So let me do some research and
that'll be good. Get some research.
see what we got. But I mean, resting heart rate is normal. He's not painful on palpation. Would I ever recommend that anybody ride this horse or do anything with him? Absolutely not. But he is stable for today. So let's do all the things with him. I'm really curious to know if he's able to lie down and get back up. That's another big question that. Is he really easy to catch?
Yeah.
You guys want to put him, if he has a buddy, in the 10 acre? Because I feel like if he's gonna nap, that would be the most likely place for him to nap. And then just, if staff would keep an eye out and see if we see him sleeping, that would be great. You're a good boy.
Might just be easy to catch with her foot right now.
She seems very sweet and also very food motivated. I'm glad you're not a mare.
Yeah.
Often when the pelvis tilts like that, then you get feces in the vulva. Yeah. I would love for him to go in the 10 acre. He also really needs stat farrier care. Ooh, some overgrown toes. Okay, I know you don't trust people. She's got a pretty significant heart murmur. You're a good girl. It's okay. I just want to try a tail pull on her. Okay, that's great. Can you stop? Good girl, you're okay. I know, this is very weird. Please don't drag Peyton around. Okay? Okay, thank you. Her proprioception is normal. You're a good girl. Looks like she bruised it. Her jaw looks fine. I can see that abscess tract, but everything in there looks okay. So she is 25, but her teeth look pretty decent. Let's go ahead and give her all the things. You're a good girl.
Who's that string?
It looks like trauma to me. Like she got poked on something. You're okay, I know. This will keep the flies off. You hate it, I understand. Yeah, but it just feels unnecessarily difficult. I don't know. Cindy, you want to check off Equispot, Quest Plus? Okay, ma'am. Oh man, that DSLD looks terrible. Sorry, old man, you're a good boy. May I see your mouth, please? 29, maybe? Sydney, his murmur is a 6 out of 6. So sometimes those are a little complicated. He is so sweet. He's about 30. Sorry about the mini mules, they're very vocal. He was able to get up with some assistance. He did respond really well to the pain medication. So initially his heart rate was over 110, which is extremely high. Upper end of normal for a horse is around 35. And obviously, exercise or stress can elevate that a little bit. But his resting heart rate about 2 hours after having IV pain medication was still in the 50s. He does have an advanced heart murmur. We grade murmurs from 1 to 6, and his was a 6. I could feel it from the outside of his chest. Heart murmurs can be caused by all different kinds of things, and anytime a horse has been laying down for a long period of time, I love to let them kind of recover from that. Hydration status can affect a heart murmur, but usually those are the milder murmurs, and this was pretty severe, advanced, and at his age, I suspect he actually did have cardiac pathology. He also had swelling in 3 of his forelegs and was very lame. He had deep suspensory limb desmitis, so DSLD in both of his hind legs, and then he had a pretty sizable gash on his right front shoulder that kind of went up into his leg with some swelling. So he was in pretty rough shape. He also had some pretty severe dental attrition, so his teeth were very worn. And then he was missing a lot of incisors, and his body condition score was 1. We want to see it closer to 5. So he was very, very thin, very painful. And I'm thankful that he had enough time that he could get up and eat cookies and get a drink and kind of calm down. But ultimately, I don't think it would be fair to him to ask him to keep going with all of the comorbidities that he had on board. So he's going to get some cookies, and we're going to give him the last act of kindness. I've actually been asked an unfortunate number of times by people about how we can be confident that animals feel pain, which I think is kind of mind-boggling. But it is both rewarding and heartbreaking as a veterinarian to work with these animals that have been painful for a really long time. And anytime I can, even if it's a little bit of time, I love to give them really good pain control and then just give them a few minutes. You know, they can't tell time, so they don't know if that bucket of brain they're getting is taking them 15 minutes or 2 hours to eat. But it is really rewarding to be able to alleviate that pain. Even, we lost a mare this morning who had been down in the trailer and stepped on a bunch, and just being able to see her eyes soften and her muscles relax is, you know, we did not wait on that one. She couldn't even pick her head up. She was in incredibly bad shape, but being able to see her go from tense and afraid and painful to relaxing, and Trey was there with her and talking to her, and, you know, when they take deep breaths and when their bodies relax and her heart rate started to come down, it's heartbreaking that that's all she gets, but it's very rewarding to be able to give them that. And it makes a huge difference not dying alone. I think it's worth it. So I think there's people who criticize organizations that do what Horse Plus does. We have a very high euthanasia rate of these buyout horses that we have come in, but I think it's worth it. I think we owe it to them. I think they deserve to have comfort and dignity and respect in the end of life, whether that's for 10 years of retirement or 5 minutes of not feeling pain after years of being painful. So thank you if you've donated to Horse Plus. We couldn't do it without your support. And as heartbreaking as it is to be the person to be here for these horses, it's also an honor. You're a good girl. Okay. Good girl.
So then this there's another, I think euthanasia horse would be
Okay.
priority. We do have the trailer up here, so I think we can put 3 more down
Okay.
outside of the crematorium.
I'm just trying to minimize.
If you can't catch one,
I'm just trying to minimize like me standing around, because I can keep doing physical exams if I have horses.
yeah, let's have, there's 2 euthanasia horses in here.
Okay.
Either
I know you guys are completely capable of making your own euthanasia decisions, but it's helpful to be able to talk about them. Look at that cute thing.
it's a little miniature Arabian. So this one's got a bad
I think that's a full-on Welsh pony.
yeah. Either one is the bad leg.
Looks like 2 fractured carapaces. Oh my goodness. The receptor is present. This is horrifically bad. Like, that's the worst arthritis I've ever seen in a carapace, I think. This is just, all of this is giant, abnormal, horrifically horrible bony proliferations. Sorry, I'm really impatient. It's so horrible. Yeah, I'm sorry. I think that other carapace is gonna look just as bad, but this is just, she has to be so painful. I mean, it's horrible, absolutely horrible. Look at this, just inexcusable. She's 29. That probably happened years and years ago. Look, I'm over here. Hey, I'm coming up next to you. Do you see me over here? Hi, what do you think? Good boy. Oh. Oh my goodness. Look at your mustache. That's very handsome. What a good boy. We're not gonna do the things to you. Yeah. You don't know what a cookie is? That's very sad. Correct. He is 24. I called him a Tennessee walking horse and I need dental rads. I would like to take dental rads on this guy, but he's relatively stable. He's 24, he needs that left eye removed. Otherwise, he seems comfortable for today. So I'm gonna put him down for dental rads. Hey buddy, I'm gonna pull this off of you, okay? Good boy. If you wanna still bring him over here, that would be great. 872. Hi Bubs, you're a good boy. Sydney, if you have euthanasias that you're not doing today, does it help to have them microchipped? Okay. So this guy is abnormal in his pelvis. He needs an eye enucleated. I think that's a lot to ask of a 24-year-old. He also has a locked mandible. I think he's got dental disease. So let's just microchip him. He's a really good boy. Let's put him in the, Tani, is it okay to put him in the round pen? Okay, Peyton, let me hold him so you can take your lead off. And then if you feel safe, do you mind taking him out to the round pen and let's make sure there's hay and water out there. You're a good boy. You're a very good boy. He's like, what about that Velcro? This guy, his proprioceptive placing is pretty abnormal in the hind end. So those angles are pretty hard to evaluate. But he needs an eye removed, he's 24, and his proprioceptive placement is abnormal. So, you've got lice or just really bad dandruff. Another bad heart murmur. Sydney, you want to try to get some Equispot on his legs, if he'll let you? Sorry. He's got like almost fly strike going on. How old are you, Bubs? You're a good boy. Oh yeah, he's close to 30. Hi, you're very cute. Do you remember me? I gave you some cookies earlier. Those are your buddies. You're very beautiful. A little bit abnormal. I don't want you to get hurt, so I don't want to do things. Hi, yes, you're very pretty. Take some x-rays of your back, okay? You're doing great. The twitching is so bad that I cannot hear the heart. All right, will you tolerate this? Can I put this on your legs? I need to hear your heart, and you're very irritated by these flies, and I don't blame you. I know, they're very irritating. You're a very good boy.
If you pull that panel over, you can walk along by itself.
Okay, I just used a whole thing on just his legs, but. Hi, do you need to be sedated? Oh, you're not very old.
For like if you,
Yeah, you're only about 6 years old.
it would be nice for him to live more, but if he's living in chronic pain, I don't want that.
Yeah, I would not say that. I mean, a 6-year-old horse being reactive to palpation could just be behavioral, so we'll have to take some rads. You're a good boy. Very good. Okay, ready? So far, so good. Okay. right. Everything looks pretty normal. I mean, they're not. He's a weirdo, but okay. Yeah, I can clear him. And it's a form of dwarfism, but it's only affected this one part of his back. His teeth look great. His heart and lungs sound normal. His gastrointestinal tract sounds normal. He's able to walk without comfort. He was a little bit reactive to palpation, but I think it's more, I'm a baby horse and I'm in a new spot than anything else, because radiographically he looked great. He was really irritated by flies. He is sedated. And the reason why I sedated him was not that he was being poorly behaved. It was that he was so irritated by the sheer volume of flies that I couldn't get a really good listen. And anytime we have something congenitally abnormal, I want to really listen to the heart and make sure we don't have other things. So I think he has the option for a great quality of life as a pasture pet. I would never recommend that anybody put this horse into a riding program, but he's gorgeous and he has a great personality, super friendly, leads really well. He was a very good boy today. Yeah, we fly sprayed him, yes.
And he's already a gelding.
He is already a gelding unless he has 2 retained testicles, but he doesn't act like a 6-year-old with 2 retained testicles, so yes. You're a good boy. Look at this cute thing. She looks like a little Welsh pony. No, I just clipped. Hi. You're very cute. You're a good boy. Are you a boy? Yes. I did not see super closely. I do not see testicles. Hi. I gave you some cookies earlier. Yeah, you're a good boy. I'm just going to listen. It's not going to be scary. You're a good boy.
Okay, buddy.
Boy. It was very good. It was a very good sir. Okay. We don't like our hind end messed with. Yeah, 2.5, 3.5, 4.5s haven't come back in. So he's at least 3.5, but he's not 4.5. So I would call him 4, which also means we probably really should palpate and make sure there's no testicles. But that's awesome. He's very young. Yay. About these guys are, they're pretty, like I've known some Welsh ponies and they're not a beginner horse personality wise, but they're tiny. So I actually flipped a Welsh pony as an undergrad. She was a strawberry roan. Her show name was I Love Lucy. She was real cute and very naughty. Got a tiny little vein in there. You're a good boy.
Jacob, you feel it?
Yeah.
Sorry for spilling your blood on the ground. Yeah, you did great. It's a 19 gauge, so it's not really that small. I don't know why. No, it shouldn't be. I think I got enough now, but I didn't know what he would be like, and I pictured him like leaping around. I think that's enough for a Coggins. Oh, you're gonna bleed. Okay. Did he get strangles, rabies, and 5-way? This is 80, B2680. Hi. You're a good girl. You're a good girl. Hi. You're all right. Good job, Mama. You're a good girl. I know. Good girl. Good girl. That's good licking and chewing. Can I see your face? What do you think? I know. You don't trust me. I just want to see how old you are, okay? Good girl. Easy. Good girl. Very good. Okay. She's about 16. Okay, Sydney, I'm going to shoot from the left. Let's take some wither rads and then we'll do her tail. 1, 2, 3, 4, 5 pretty significant kissing spine lesions. Yep, and she's got, her withers look like she's got shrapnel in them. Okay, tail-wise, Peyton, are you able to come over here on either side and just try to hold this tail out for us?
Like this way?
Yes. Thank you, that's perfect. What her tail looks like.
That's crazy.
She's got some osteoarthritis in there,
Poor thing.
but she also has
Oof,
this in her nuchal ligament.
poor thing.
That's some pretty bad,
Yeah.
I mean, that's just like full-on calcification within that nuchal ligament. So this is her,
Yeah.
yeah.
And she's responsive to it, so that's not good.
She is, yeah, she's reactive on palpation. So she's about 16. I don't think she's,
She'll probably be fine. She just needs to be.
let me give her some pain meds.
Yeah. Just make
And do you want to try to get a halter on that one and just see? If you can't, I can give sedation IM instead of IV. I'll just go IM. All right, what a good boy. Okay, very good. I'm sorry about your leg. We'll try to get that off for you, okay? What do we call this? This one looks black to me. Okay.
If they have brown on their nose, they're okay.
I called her Dark Bay. She's got brown on her whole body, but he looks black. That mirror strikes me as somebody that, like, she's probably been really painful and somebody's been working her anyway, and so she's super reactive. Buddy, what a good boy you are. Yeah. Yeah, Trey, let's see if we can get him moved forward right here, because I'm gonna have to be able to cut the bandage off. But I'm gonna wait until he's more sedated before I do that. Good boy. He looks young. What is going on with your leg? You good boy. Good job, sir. Actually, not that bad. I mean, obviously, I need an x-ray to tell, but like,
Tail tendon been cut at all?
someone vet wrapped a splint boot around his ankle. He looks young to me. I have not gotten his age yet. He is sedated, but I gave it to him in the muscle, so I would be careful. He's not very sedated. Do you know about cookies? Are you more sedated than you're letting on? Oh, you're baby. So he's 4.5. Good boy. I'm gonna try to palpate back here, which he might not appreciate. Yeah, he's got a scar, so I think somebody gelded him. You're a good boy. Good boy. Sydney, it might not be worth it, but could you bring the clippers over and just see? It'd be great to get the gross gunk off that leg before we take rads. I'm gonna pull some blood, and then if you'll come over and just see. If he's super reactive to it, we're not gonna sweat it, but he seems pretty mellow. You're a good boy. Good boy. Good boy, very good. So Tani thinks he's gated. This is really cute. We're gonna take a radiograph, but I feel pretty, he sounded a walk, so. Yeah. All right, I'm set up to do the pokes, but let's take this radiograph first. Hi. You're such a good boy. So number 1, don't get hurt. Okay. And then I'm gonna try to take an oblique. Yeah, the bone looks fine. He's got a little roughening up here. I'm gonna try to take an oblique. So if you'll put the plate back where it was. Yep. It's a gnarly skin wound, my dude, but your bones look okay. All right, let's do all the things. Yeah. He's got a little bone roughening, which is not surprising, but with the location where it is, I think he'll do fine. Like, I think there's a great chance that horse is gonna be rideable. I mean, who knows? He might have some soft tissue stuff that's gotta work out, but he sounded a walk, so. And he's young, so he's got a fighting chance. Hi, are you so worried? It's okay. All right. Yeah. Hi, you're okay. Hey, little buddy, you're okay, I know. You're okay. I need his head up when I squeeze, so tell me when his head is up. You're okay. Easy, you're okay. Oh, no biting. Yeah, he almost got me. Thank you, Trey, that's very helpful. Oh, I'm gonna have to use butterflies for these little guys. He just bit it. I gotta get an age. I actually don't know a gender either. Okay, listen, you can't bite. You can't be biting, okay? Listen, we can be friends, okay? Okay. No bites. I know you're scared. I know you're scared. I gotta see your teeth. Okay. I think we're gonna have to just squeeze him a little bit more because I can't. Just watch out. He knows how to bite. He's aiming. I keep saying him. I have no idea if this is a male or female. I'm gonna unsqueeze him. Okay. 5-way went right hind. Strangles is going left hind. And I can microchip from this side too. She did not have a microchip, I already scanned her. All right, little dirt. Okay. She should be good. Hi, little buddy. You're okay. Can you put your head up any more for me, or is that as far up as we got? I only have one more 90 gauge butterfly, but I'm gonna have to use it. Good boy. Okay, 2.5s are in, 3.5s are not. So we're gonna call them 3.
Okay.
Yep.
Okay with you?
Yeah, you be the boss. You are Stan and Nicole. You are my boss today. Well, that's not gonna work. I need the neck, so unhelpful. We could try to palpate when he's in there. Left front. Will you let me listen to you out here? What do you think? Good boy.
How would you use hydroperoxide?
It's new enough that I think you could use hydrogen peroxide, but hydrogen peroxide disrupts clot formation. So unless you use it right away, I don't like it for wounds.
Do you use the iodine for calcium?
Yeah, so this is safe. I mean, you can get it in eyes and it hurts less. It doesn't work quite as well as the chlorhexidine, but you could leave it on the tissue and it's not as irritating. So I like betadine. All right, I think we can get what we need you done out here. And there will give you your answers. I mean, you could actually texture that.
Good job.
Good. I can't tell if he's just really chill or he feels really terrible.
I think it feels terrible.
Maybe a little bit of both, but yeah, I agree with you. I think he feels terrible.
He also has sores in his mouth too.
Yeah, he does not feel well.
Strangles?
We are 2.5s are in, 3.5s are not in, so we're about 3.
These are the last 2 horses we're intaking. We have the little miniature mules. We'll be intaking them. Today's been amazing. Definitely watch the episodes. You can kind of see what happened here today, and there was definitely a lot of kind of stress happening this morning, and I wasn't sure we were going to be able to rescue these horses, but thankfully we were. Jacob's been great behind the camera filming the Almost Live. I know he's got to go edit, so I'm going to turn it over to him.
All right, so that's buyout for April. I'm gonna get back to the office now, edit this all up, and get it out to you guys.